Hi, I'm Dr. Jeff Crane. I'm an American board-certified internal medicine doctor. Primary care has been my life for about 30 or more years, both in the American and the Ukrainian system. I want to talk with you today about setting a framework of how doctors and patients have a dialogue and how that can be most effectively done. Some have described the doctor and patient dialogue as an Argentinian tango dance, in which either the patient or the doctor leads at different parts of the interview. So let's talk about this and unpack it. There are four main ideas about getting started, beginning, finishing, and concluding. Those have to do with greeting and setting an agenda. The second step is patient-centered listening skills, where the doctor doesn't talk and lets the patient talk to him or her. The third part is a detailed history and physical, where your doctor will drive the decisions about what's talked about. And in the fourth and final section, there's a conclusion and a shared process of dialogue and decision-making together. The first step in the process is to greet and set an agenda. This needs to be a very short interaction in which you introduce yourself, such as, "Hi, I'm Dr. Crane. I'm the primary care doctor seeing you today. You're Mrs. Smith, right? Come into my clinic and let's have a conversation." The next part of this is to give a perspective of how long our conversation can last, and that you want to make sure that you're hearing what she has to say. Phrases like, "What brings you to see me today? Help me understand what's bothering you the most." Or, "Please let me hear this in your own words. How do you understand that you're sick?" These are designed to give the patient a chance to just talk and tell her story. You might active listen, such as saying, "Yes, I see," or "Uh-huh," or "I've got that." Or you might ask clarifying questions like, "Tell me more about that. When does it bother you most? What makes it better or worse?" Okay, after you've set the agenda and you've clarified the patient's main concerns, the third step in the process is the physician-driven interviewing skills, in which you ask more direct questions like, "Tell me about your family history. I want to understand, did anyone have a myocardial infarction? Or have you had any surgery, or do you have allergies?" You'll do the physical examination and drive that whole agenda. And then the fourth process, the fourth step in this framework of the dialogue, is to sit down and conclude the visit by summarizing what you've learned today, summarizing that you've heard the patient's concerns, and then setting out a plan of what to do next. When we go into the examining room with a clear mind of saying, "I'm going to introduce and set a plan, I'm going to listen to the patient, I'm going to drive what has to be done medically, and then we're going to have a dialogue to really conclude together at the end," you've got a framework that really helps you give the patient what they've come to see you for: excellent medical service. Next.
Me?
Okay, who are you?
Your 2 o'clock appointment.
Yeah. Okay, what's wrong with you?
Well, I have a list of things.
Oh, brother. Choose one.
Okay, my liver hurts.
Oh, I think that's ridiculous. Artyom,
Dr. Crane,
good to see you today.
I'm glad to see you again.
How are the grandchildren?
Oh, doing well, thank you. Very
Good.
well. Not like me.
What brings you in today?
Well, actually, there are a few things. If you don't mind, I would like to list them to you.
Sure.
I wrote them down. Well, my liver hurts, and I started having frequent headaches. And, well, my left foot seems to be swelling.
Really?
And in all of this, my wife doesn't seem to be helping. She just thinks that I'm just making it all up.
I see.
Yeah, and that medicine that you prescribed to me the other time, I think it gave me the rash.
Oh, several things.
Yes.
Well, listen, we've maybe got 20 or 30 minutes today, so let's do this. Why don't you tell me the one or two things that are most important to you? Let's try to deal with those today. And then if we can't do it all, we'll bring you back next week, okay?
Okay, well.
Hello.
Hello.
How can I help you?
Well, I have headaches, and they began like 2 weeks ago.
Are they bad?
Yes, well, pretty bad.
Where are they in your head?
Well, starts here and then kind of moves to the
You've been having them a long time?
2 weeks, as I said before.
Oh, you said that, yeah.
Yeah.
You know, do your ears bother you with this?
My ears, I'm not sure how can they bother me.
Have you had COVID?
I don't know.
Artyom, what's bothering you today?
You know, I started having these headaches, and that really bothers me.
Tell me more.
About 2 or 3 weeks ago, I don't really remember when, you know, I woke up with this significant headache. It went away in the course of the day, but, you know, it seems like almost every morning when I wake up, these headaches, I begin my day with a headache.
Really?
Yes.
What seems to concern you most about them?
They don't go away. They seem to be coming back every morning, and I'm afraid that there is something wrong with me.
You're afraid. What are you afraid of?
Well, what if I have a brain tumor?
I see. Okay, we're here for your gallbladder, right?
Yes, yes.
Yeah. So it's pretty clear. The gallbladder is full of stones. It's all that bad fatty food you've been eating all your life. You shouldn't have done that. Now listen, the way we handle this is an operation.
Can we do it some other way? I'm afraid of a surgery.
Well, I've decided what you need. It's clear that you need to have the gallbladder taken out. I've actually arranged surgery next week for you.
Next week? But I have a business trip next week.
You need to cancel your trip. I've already arranged everything with the surgeon. So, Artyom, we're here to review the results of your gallbladder studies, right?
Yes, I hope they're okay.
It's okay. We'll walk you through the results. Your gallbladder has some stones inside it.
Is it bad?
No, it's a pretty common problem, and we can walk you through how to solve this. So let me show you some pictures of what a gallbladder is and what stones inside it look like and why they cause problems, okay?